We will now have a introduction on Nurses Labs. So, Nurses Labs is one of the new blogs that we have recently come up with. So, it's a one-stop nursing solution for all your nursing needs, whether be it you're a student or a nurse in whatever field. You will be able to use this application. I hope you all can hear and see. So it all started mainly to enrich the knowledge of our fellow nurses and nursing students across the globe. So our first speaker for the day is Dr. Puvaneshwari. So Dr. Puvaneshwari, I will be introducing her. She is a MSc holder, PhD holder, and she's an assistant professor in the Department of Medical Surgical Nursing, University of Bisha, Kingdom of Saudi Arabia. So, ma'am has been a first rank and gold medalist in BSc, a distinction holder in MSc and PhD. She has won a Best Employee Award in Feb 2020 from Narayana Hridayalaya Foundation. She has been a resource person for 27 conferences, webinars, and workshops. She has a recognized PhD evaluator in JSS University, Mysore. She's a recognized PG guide and UG PG examiner by Rajiv Gandhi, University of Health Sciences, Bangalore. We welcome you, ma'am, for this webinar, and we ask that we'll be inspired and by your words this evening. Over to you, ma'am.
Thank you, Ms. Tanya. Without delay, I will be starting my presentation. Thank you, Nurseslab, for inviting me to present a topic today related to our International Nurses Day celebration 2025. Even though it is on May 12th, we are celebrating today on May 17th by considering everyone's availability to attend this webinar. Thank you so much for this opportunity. And with the theme of International Council for Nurses, that is caring for nurses, which is very, very important for a strong economy. Under the ICN, they have divided into 3 topics. The topic which is allotted for me is like unmet needs and acknowledged struggles, which is a challenge for the current workforce. With that title, I'll start my study presentation. This theme, which mainly highlights the critical impact of nursing in shaping the future of healthcare. As we all know, nurses are the important backbone for the healthcare, and the government or the international agencies, how much they are investing on the healthcare. So it is very, very important that the need for greater investment in the nursing workforce to ensure a global health and economic development. Still, we are in like halfway. So with that, this theme was generated with the International Council of Nurses. So all over the world, we are talking about this now. Today's presentation, I will be focusing on the global workforce crisis and the widening gaps and the increasing pressure which is on the healthcare, rising the nurses' attrition and the dissatisfaction by the nurses, and the social and economic impacts of failing to care for nurses, challenges and the impact, and what are the factors which is impacting the nurses' health and well-being, and what is the ICN caring for nurses agenda for the sustainable workforce well-being. When we look into the global health, that is workforce crisis, there is a growing threat to the economy related to the healthcare. As all of us know, nursing workforce is under an immense strain as healthcare challenges intensify, that we evidently seen during COVID-19. And nurses are very, very essential to achieve the sustainable development goals, which is addressing the chronic diseases, aging population, as well as the global emergencies. There is a statistics which is given in 2020 by WHO. That is, they highlighted that there is a need for 6 million nurses all over the world. It is in the year of 2020. But in 2022, there was a study which is done by Hackenstack. They said like to achieve the higher universal health coverage scores or the sustainable developmental goals, it is very, very important to have the number of nurses that is about 30 million. So that is 30 million nurses are needed to have a good healthcare. Yet long-term investment and workforce planning is always like, it has remained very, very insufficient, even in developed countries like US. And without an urgent action, the healthcare as well as the economic stability of many nations will be at a serious risk. So with that, the ICN had brought out this theme. What about the widening gaps and increasing pressure? There was a recent survey which was done by ICN in 2025. They have done a survey among 68 countries. So the results showed 61.7% replied that increased demands on nurses from 2021. It was very evident, like all over the world after COVID-19, even the people those are joining for nursing also have increased. But at the same time, quitting the nursing job also have increased. So with that, they say like 61.7 increased demands, and 40% reported that the current capacity we can term like it's very poor or it is poor. That category they have said it's a very big number. 40% is a very big number to consider it is very poor. And 41.8% of countries, they say there is no improvement in vacancy rates. Vacancies are there, but there is no employment. And high income countries also reporting like raised unfilled positions. The crisis is not just about the supply. It is even the inadequate funding, which leads to the nurse underemployment, even with a lot of shortage what we have. So which can lead to a lot of consequences like burnout. Nurses are in dissatisfaction, and nurse migration, that is another important factor. And loss of trained professionals, definitely it will be weakening the source countries. It exacerbates the global inequities and worsens the care access. So this is a major consequence which we can face. The nurse attrition, people are dropouts. Attrition is a dropout or dissatisfaction. A study which was done in 2025, they reported that 48.4% countries report a moderate to great increase in nurses leaving the profession since 2021. And another study reported in 2023, nurse shortage plus unemployment, it's equal to the evidence of underfunding and policy failure. So if we have a policy failure at the governmental level, definitely it will have a great impact in the healthcare system. And workplace dissatisfaction and growing nurses strikes and protests worldwide. I see in 2022, they said there are a lot of strikes happening all over the world, which is signaling urgent demands for the fair pay and better conditions. When I have just quoted 3 examples here, there was a strike in Rajasthan, that is Rajasthan nurses protest in August 2023. Chennai COVID nurses protest September 2023. Actually, this strike was happened because of like there were almost 900 nurses are recruited temporarily to take care of COVID patients in 2021, but they were like informed that they will become permanent. But it was not happen in 2023. With that, there was a strike, and Surat nurses strike. Again, this also related to a high pay, or there is a revision of payment and so on. There are a lot of requirements they had. So this is very evident in India also. There are a lot of strikes are happening like all over the world. The social, economic, and impact of failing to care for nurses. Director General of WHO in 2024, he reported the workforce crisis is an economic issue. We all know like WHO is a very important organizations related to healthcare. So they accept that workforce crisis, if it's doctors, nurses, or healthcare, any team members, definitely it's an economic issue. Without urgent action, definitely we may face many issues like unnecessary deaths and weakened economies, growing global inequalities, and short-term fixes. Sometimes, the international recruitment they do on casualization, even in Saudi Arabia, you can see like there are many nurses come from other countries. So the Saudians will be very less compared to the other people. But the Vision 2013, this is one of the short-term fixes to solve the issues related to the manpower. They fix it like international recruitment, they do. But it's not going to give a clear solution for them. So what the government is focusing with the Vision of 2030, they want only Saudians to be working in the Saudi government. So they start more universities, they train more Saudians. So this is not only happening in Saudi, in all over the world, like Oman, many countries, many UAE, everywhere they're trying to do it. So when they're trying to fix the root problem, definitely it will give a good solution for them. And all income countries, whether it is a low income, middle income, or high income countries, everybody is affected with this shortage of nurses. And investing in nurse well-being, definitely it will be improving the capacity by 20% of the economic. So that was given by Brittle in 2019. The social economic impact of failing to care for nurses, they say it's a big number. Like $9.8 trillion healthcare sector is consuming. In that, 10.3% is a global GDP. Yet our healthcare system is suffer with stagnation and the workforce gap, because the human resources sometimes are neglected, even though in the labor market compared with the other field. So the government definitely must prioritize the human resources like financial ones. So a failure, definitely it will be leading to keep a risk for everyone's life as well as the future growth. The health and well-being of nurses, what are the challenges and impact? Normally, we feel nurses are very highly trusted, resilient, and deeply committed, yet face unsustainable stress. It is very evident in India. We don't express. We still do work. They won't go to a strike immediately. They will always accept and try to do their maximum. So many of them say, I love my work, but I hate my job. This is a word. So this shows a dissatisfaction. So underinvestment and poor conditions definitely pushing the nurses to a breaking points. This is some of the evidences of that. Like over 50% of health workers, they replied that they regularly think about quitting their job. This is a recent evidence like by Public Services International in 2023. It's a big number. And 80% always they feel they worked over capacity. That is another fact. And almost 20% of nurses worked twice as much as their anticipated workload. The workload is also very, very high. So 61% European nurses reported moderately to extreme job strain in 2024. We feel like in India only we have this problem. It is not so. All over the world, the problems of healthcare workers or the strain on the nurses is very high. So the health and well-being, mainly the challenges and impact, the core drivers are unsafe staffing and excessive workloads, poor payment, burnout, and long-standing systemic neglect of nurses' well-being. So it's very evident in any organization, the nurses are not taken care that well. So the neglect part is another fact. And turnover cost, that is very high. It is the people are investing, but the turnover is very high because they don't like the job, they feel burnout, they quit the job. So the loss of nurses is definitely equal to a weaker care system, which is leading to a slower emergency response, which can lead to a death of people and economic strain. And similarly, I have told us the global health sector spends a lot of money, but 50% on the labor. But again, they are neglecting the healthcare system, like nurses, doctors, or whomever it is. So this is given by David Stewart by ICM. So what are the factors which is influencing nurses' health and well-being? I think every one of us can correlate with our factors when we started from our career from BSc nursing or a diploma nursing. So this is very evident. There are a lot of evidence statistics are there. So workload and staffing imbalance, definitely it is leading to a burnout, job dissatisfaction, and which ultimately lead to a poor patient care. When workload is very high, they can't do a care properly, and increased medical errors, physical health issues, as well as psychological stress. In 2023, they said 1 by 3 of frontline nurses have witnessed patients die due to staff shortages. So even when I used to speak with some of my colleagues, those are working in the government sector, they used to say, we feel very dissatisfied because we don't have manpower to work with. So we know the patient is dying in front of our eyes, but we are unable to manage them. because of a shortage of human manpower. So this is a very, very important factor which needs to be taken care. Private sector, somehow it is getting balanced, but again in the government sector, in some of the places, the workload for the staff is very, very high. And workplace safety and environment. So the healthcare sectors are inherently risky with a lot of unpredictable, complex environment that pose hazards to both the workers as well as the patient. There are two evidences I just mentioned here. Virar Hospital fire in April 2021 in India and Jhansi Hospital fire in November 2024. So these are all, even recently there was a fire accident in Chennai, one ICU. So these are all the some of the evidences, like we are at the risk, not only we, the patients are also at the risk in the workplace. Violence against healthcare workers, it's very common nowadays. Physical and verbal abuse from patients or families or even the colleagues can lead to a physical injury, emotional and psychological distress, which is leading to a lot of trauma, stress, and fear not continue our job. So the evidence from international statistics, like over 24% of healthcare workers experienced a physical violence in 2019, study says. And in 2023, they said 2,500 incidents of violence, including damages to the hospital, healthcare workers being killed, kidnapped, everything is happening. So there was a report in India. That study reported that 58.7% of healthcare workers experienced a workplace violence, with 20.8 facing a physical violence and 66.8% encountering a verbal violence and 10% subjected to sexual harassment. And it is very alarming information is 80% is not reporting. So this is the information what we have got is only from 20% of people those have reported this. This is from international evidence, like 9 out of every 10 Canadian nurses are experiencing violence, which was given in 2023. And 2 nurses are assaulted every hour across the US healthcare system, which is given in 2022. So definitely a workplace violence will be leading to a reduced work performance and decreased productivity, which has to be really taken care of. Otherwise, this itself will be an alarming or a force like not to take a nursing or not to take a healthcare field in their career. The nature of the work, so the emotional strain can take a toll on nurses. So with that, they lead to like compassion fatigue, emotional exhaustion, and moral distress. Definitely, it is affecting the well-being of the individual. And 1 in 10 nurses are suffering from high burnout symptoms from 2020. Even when I look into this burnout, I remember one of the recent study which was done by our students in Saudi Arabia. They say even those are having a high pay, they also have a burnout. Normally, we feel that burnout is very high in low salary people, but it doesn't mean that study reflected like it's not like that. Even the burnout, whether the nurse is having a high salary or a low salary, the burnout is very high. Maybe it is one of the reason is the manpower. We didn't explore on the factors of that, but one of the reason will be the workforce. Organizational culture and decent working conditions are definitely a positive organizational culture will give a good working condition for the nurses. Negative culture, definitely it is characterized by a poor leadership, lack of support and ineffective communication. So that leads to like quit the job. 32% of nurses studied, like they report that they whatever salary they get, it is just enough for them to come out of the poverty. It is not like giving them a good luxurious life. 20 to 30% of nurses leave, like they want to leave the job because of a poor workplace culture. This was given in 2025. So organizational culture also plays a very, very important role in keeping the nurses in their position. Organizational and systemic inefficiencies, it can be due to like outdated process, poor communication, and excessive bureaucracy, which leads to a lot of frustration to the nurses. More than 76% of doctors and nurses, that healthcare team, they reported that they're overskilled for the roles and responsibilities what is given for them. Their education is very high, but the job what they do is like not expected, like what is expected to do by them. So that is also another stress they feel it. And this is very simple, which we all know. We are all exposed, very highly risky group to have a physical health hazards like influenza, coronavirus. During COVID-19, we know how much percentage of like healthcare workers were suffering and death. etc. Tuberculosis and other respiratory infections and other pandemics like Ebola, that is also very high when we are exposed to the patients. And during 2014, the Ebola outbreak in West Africa, they said like 103 times the healthcare workers are very higher risk compared with the general public. So physical health hazards is very quite common. Other than this, we know like needle stick injury, all those things. I didn't put those things here, but this is a major related to a pandemic or related to a respiratory infections that are contagious. We are very highly risky. And what are the mental health challenges during pandemic? It's like it is reported like 23 to 61% of nurses experienced anxiety and depression, and 80% experiencing burnout with the 2025. And another important one, secondary traumatic stress. So this also the nurses feels because of a prolonged exposure to like seeing a patient suffering. And 79% of nurses report working below their skill level, like day to day, like they feel like they are not utilized properly or they are underappreciated. So this workplace infectious diseases impact like health system. So it can have a direct and indirect consequence like risk of short-term and long-term illness, distress, and lower work performance and productivity, and cost of workers' compensation, sick leave, and replacing the staff. These are all the things like they need to consider while they are making a policy, and increased absenteeism and turnover and strained resources. And ultimately, these all will lead to a worse patient outcomes. So the ICN agenda for sustainable workforce well-being, which is like very, very important. These 7 points, like it needs to be in action. Unless if it is not in action, the well-being of the nurses cannot be taken care of. So invest in the right resources and equipment, provide safe and decent working conditions for the nurses or the healthcare team members, which will be giving a good organizational climate, and support education, professional development, and optimal scope of practice. Build a supportive, high-performing organizational culture, improve access to healthcare and well-being supports, and value nurses with a fair and competitive compensation. So the nurses, like whatever their problems are there, they should be able to voice out, and people should be there to listen to them and try to find the solutions for that. So to conclude, like the nurses' dedication is like everyone knows, it's not only save lives, but also it strengthens the healthcare system and drives the economic growth. So by investing in nursing, we invest in a healthier, good future. So thank you all nurses. You're the heart of the healthcare. So till now I said like a lot of challenges, lot of difficulties. So it is like whatever the experiences we have at the present. So that is one of the theme of ICN, which I have focused. So the remaining speakers will be talking to you regarding how it can be rectified and what are the future goals, all those things. So with that, I am finishing my presentation. So any clarifications, anything, maybe at the end of all the 3 sessions, we can speak.
Thank you, ma'am, for sharing your thoughts and important facts on the reason why there is social and economic failures in the nursing field and how we as nurses are trying to cope with this situation. So we'll move on and we'll go and introduce Dr. Vasantha Gurusamy, PhD, MSN, RN, and Assistant Professor of University of Pittsburgh in USA. Ma'am, we hand over this meeting to you.
Good evening, everyone, and thank you for joining us in the International Nurses Day 2025. I'm very glad that they invited me to talk for this webinar, and though it's a week later, so it's a convenient time for everyone to share our ideas and thoughts on this year's theme. And it's a privilege to connect with such dedicated professionals worldwide, united in our missions to advance nursing practice and enhance the patient care. And today we celebrate the remarkable contribution of nurses, especially under this year's theme, that is caring for nurses strengthens economies. We will explore the innovative practices and overcome the challenges that strengthen our profession. Let's appreciate the resilience and the passions of nurses everywhere. Together, we can elevate our profession and advocate for our vital role in healthcare systems globally. Thank you for being here, and let's get started. So why we need the transformation? According to WHO, there was three imperative, workplace well-being reasons. Number one is ethical reasons, responsibilities. Actually, the organizations have moral obligations to protect the workers genuinely, and we cannot value the health without, maintaining appropriate working conditions. And so if we are expecting a healthy working conditions, means there should not be any harmful environment. And the economic advantage, healthy workplaces lead to higher productivity and improve the performance and better patient outcome. And third reason why the WHO recommends is the legal obligations. Many countries mandate that employers ensure their workers' health. I mean, if there is a neglect workforce health, that results in legal repercussion to the organizations and damage to the reputation of the institution. So this three responsibility means the reasons why the need for transformation, it's imposed into the healthcare organizations. And can you see my screen? I'm sorry. So the theme which is given, and I'm going to talk about building a healthier future and comprehensive solutions for nurses' well-being. So for this theme, we have two effective strategies. One is building healthier future as a holistic approach to the well-being of the nurses. Second one is a global call to action. So the ICN's Caring for Nurses agenda for sustainable workforce and well-being. So number one is effective strategies for supporting nurses' health and well-being. Actually, supporting nurses benefits everyone. So if the nurses are getting supported, so they will be giving productive work. So the output of the nurses will be better, so that they can give a better outcome for the healthcare organizations. So this report highlights the urgent need for strong nurses workforce to improve the patient outcomes and enhance health system productivity and ensure equitable care. Despite the moral and economical and legal reasons to support nurses, they face overwhelming pressures that compromise their health and their delivery also. So there are current approaches. There are many approaches. Whenever there is a problem experienced by the nurse or some incidents happens, some consequences happen in the system or organizations or institution. So they have solutions, but it is all short-term fixes, and there is an isolated programs which is focusing on that particular incident and issue, and they try to solve it. And it is focused on a particular individual who is experiencing the problem, but it is it's not sufficient to for a long run. So they need a holistic approach or a standard of care and standard of practice by which any expected problems to be solved, like challenges such as heavy workload, burnout, mental health issues, and workplace violences arise from deep-seated structural problems in healthcare, health systems and society. These issues cannot be resolved merely by advocating for resilience and fragmented solutions. So we should not have a fragmented solutions, like whenever the problem occur and we are finding the solution and we are giving, solving the problems. We should have a holistic approach and to address the complex factors affecting the nurse's well-being. So number one strategy is building a healthier future is a holistic approach for the nurses' well-being. So we need to have a healthier future for the nurses. This can be achieved, we need a coordinated action to prioritize the well-being of nurses and sustain strong nursing workforce. According to the ICN's 2023 Charter for Change, establishes a foundational framework. The ICN International Council of Nurses framed a policy on a foundational framework. This is aimed at safeguarding the well-being and sustainability of nurses' global workforce and health systems. So the Caring for Nurses agenda outlines the actionable policies. So it has some policies and how to implement the policies in order to have a healthier future. So that's what we are seeing today. So this agenda aligns with ICN's 125th anniversary declaration and sustain retained report. This emphasizes need for strong workforce we need to have a strong workforce to tackle the global health priorities. These strategic documents outline a plan to empower nurses with the resources needed to deliver high quality care and strengthen the health system globally. According to the Nursing Policy Practice Director David Stewart, he says that we need a bold new vision for supporting nurses, one that can only minimizes burnout and workplace assaults, but creates the essential condition that need for nursing workforce to flourish within the healthcare environment. This means that building health systems where nurses feel valued and enabled to practice using their full scope of expertise, where their physical and psychological safety is protected, where they find meaning and purpose in fulfilling their vocation to care, and where the next generation of caregivers feel drawn to join the nursing profession and shape the future of health. So that means overall it's supposed to emphasize the situation and the environment where the nursing profession is practiced. It should attract the future generation to join in nursing profession, as well as the people who are working. They should have they should feel they're valued. And the global call to action, so it has like sustainable work, the sustainable quality patient care and address the global nursing shortage. We must create workplace where the nurses are not just surviving but thriving. That means making safety for fair compensation, autonomy and support, and they should be emotionally happy to the way the healthcare system is operate. So the caring for nurses agenda respond to urgent need for holistic, comprehensive and effective strategies to ensure that every nurses, regardless of where they work, it can be any country, developed or underdeveloped country, any country, so they should have a safe access, supportive and healthy working environment, so that they will be motivated to work. The caring for nurses is comprehensive and actionable model designed to promote health and wellness of nurses as essential for sustainable and effective healthcare system. So it's supposed to work in different levels. Number one is at the institution level, the healthcare providers, the managers and the leaders must create an environment that support nurses. So the administration of the organization should support the nurses so they feel comfortable to work with. At the national level, the government and health policymakers should adopt the policies that safeguard nurses. At the international level, health systems should collaborate between the countries to ensure health for all. Nurses and global health organizations should set standards and advocate for policies and protect and promote nurses' well-being. So according to this ICN's Care for Nurses Agenda for Sustainable Workplace, there are 7 critical areas where they have to focus. Number one is ensure adequate staffing and skill mix for effective care, and invest in right resources and equipment, provide safe and decent working condition, support education, professional development and optimal scope of practice, and build a supportive and high performance organizational culture. And 6th one is ensures access to the healthcare and well-being supports. And 7th one is value nurses with fair and competitive compensation. Number one is adequate staffing and skill mix for the effective care. So the nurses only deliver the safe and high quality care when they have a sustainable workload. That means we expect the nurses to work effectively, and the patient care is effective. That means they should have adequate workload. If there is a shortage of nurses, and then we are asking putting pressure on the nurses to take care of n number of patients, which is not possible for them. And chronic understaffing and lack of essential resources. Maybe number one is the staffing is not sufficient, and the next one is lack of resources, which has compromised the patient care. So they wanted to give care and the people are adequate, but they don't have essential supplies and equipments, so which impairs the nursing care which they provide and drives burnout and stress and workforce attrition. By aligning the staff levels with the patient needs and ensuring an optimal skill mix, healthcare organizations can provide high quality care while safeguarding nurses' well-being. So to achieve this, ensuring adequate staffing and skill mix for effective care, we have some recommended interventions. Number one is implement evidence-based workforce planning and safe staffing. So they should have adequate guidelines to work with. They should set guidelines. All the hospitals, if they 100-bedded hospital or 300-bedded hospital, so they should have this much staffing, the nurses with the different levels, the registered nurse, the nursing aides, or the nursing supervisor, how many numbers they should have, ratios and the guidelines and the set standards they have to follow, so that it should be monitored, and so that they can have a better staffing facility. And the number two is this optimize the skill mix. The one who is experienced in a particular area, it's supposed to be placed in that particular, if a person is expected to work in intensive coronary care unit or intensive medical ICU or somewhere where they're supposed to have adequate experience and skill, in order to work without strain and any burnout. So maybe anybody who is coming to the institution or organization as a new staff, so they should have the novice staff supposed to have adequate probation period where they have to be trained under the supervised expert. If there is an expert supposed to guide one-on-one for a particular 3 months or 6 months, they should have an optimized guidelines, so that if they train them, so once they're trained and they're supposed to be placed in appropriate place. If a person is not trained in a particular area and we are expecting the person to have, work in a high skilled or acuity areas, it's difficult for the person, and which leads to poor outcome, and they cannot deliver appropriate care to the patient. The next one is real-time workload monitoring and dynamic adjustments. So we have a software like a system where we can, like for example, when I work, this is just an example where this is a software system where the nurses working in a particular unit, it will be like a chief nursing officer or somebody, like all these people have their username and password. They are registered into the software where they're expected to, like every 6 weeks or every 2 months once, so they will be saying so and so day the workload will be the work list will be out, so you can choose a day which you want to work. So like for example, weekly 3 days. Here in US they are working weekly 3 days, so they can select which 3 days they are preferring. They wanted to work continuously 3 days, or they want to work alternative days, or they want to work 2 days and then a break on 1 day. So whichever way they want to work, they can select. So this, everybody who wanted to work in that, each week they have to select 3 days. So if it is in India, it might be maybe 10 days or 5 days. According to that, they should have option. So whoever is working in that particular unit, they will be selecting dates. So if they will be telling a date at what time and a date they are releasing this. So everybody is waiting for this, and then so whichever day they already prepared the roster what they wanted and which day they are planning for a vacation and they have something to do. They have to go for some other taking care of their children and going to the school, or they are planning for a tour, or any family functions or anything. If they have, based on that, they will be planning which day they have to work. And once it is released, they will be selecting the date which is appropriate for them. So it is easy for the nurses to fix. Maybe in few, like at the end of the time, like if there is some difficulty or somebody who needs an emergency where they could not put on the time of this notice came. So what happens? So the chief nursing officer or somebody, they sit together, and then finally they'll finalize. The finalized shift will be given within 1 or 2 days. So this is the way, like every month or every 2 months once, they will be fixing the dates. So for example, a nurse want to swap the shift with another nurse, so they can just request through this. This is an app which they will having in their mobile phone. So I can, like if I wanted to change my shift with another nurse, so I can just request through this app. So they will be telling, yeah, yes, I can do that. So then they can each other, they can change their shift with each other. So it's easy for everybody. So this is real-time workload monitoring. Also we have a software here in the hospitals where number of patients every day, the number of inpatients in the critical area. So I was working before in the hospital, and it's a critical care where the nurses, like number of nurses and number of patients, this will be matched with the software where it will be telling how many nurses they need to work in that particular day. Like each nurse 4 patients, or each nurse 3, or patients, like based on the acuity of the patient. Sometimes all these patients are easy, sometimes there is a critical patients. So based on the critical level, so they will be loading how many critical patients are there in the unit, or how many easy patients are there. So then how many nurses they need. So they will be fixing the shift for the nurses as well as the nursing assistants and everybody. So the software give them the unit director, so how many people they have to assign. Maybe if there is excess staffs, then they may tell the nurse means not to come to the shift, or they want to take a break or something, they can take. So this is a real-time software. Every day they just upload based on this number of nurses they need to work in that particular unit. So next one, that's about recommended actions for our first ensuring adequate staffing and skill mix for the effective care. Number 2, this investing in the right resources and equipment. So not only resource means investing on the salary and whatever they have. Also, the resources like providing nurses with the necessary tools, like if a particular unit they are working where, there should be adequate supplies and equipments and then monitors, and they should have, it's easy for them to work with. And technology, like if there is an electronic health record is there, it's easy for them. Everybody can log into that, and it's not necessary that you have to call someone and get, all the details and take in a paper. So if there is an electronic documentation, so it's easy for them to monitor what happened yesterday night. I was not there in the shift, and what happened 2 days before. So everything they can just check, and it's easy for them to, understand exactly what happened with the patient from the time of admission until now, so they can proceed and plan the care accordingly. And they should have a proper infrastructure to deliver the safe and high quality care. Yeah, also access to the right equipment and supply to reduce the patient staff risk, improve the care delivery and diverse operational efficiency. So they should have adequate, equipment which is needed to that particular, appropriate to that particular unit. It's a critical care unit or simple medical, surgical or regular unit. Based on that, or if it is a pediatric unit, based on that, they should have all supplies and equipment, so it's easy for them to function. By equipping the nurses with essential resources, healthcare organizations can improve the productivity and care delivery. So this can improve by, like, the staffs can be adequately trained, like in service education, and every 6 months once they have to have this many courses to complete. And also when they complete, even here, so the nurses are expected to complete some continuous nursing education programs. So if you complete that, how many hours you spent in that will be paid. Not only the time you are working in the hospital, how many hours you are completing your courses, which is needed for your work in the hospital, that will be paid. If you are working for 2 hours or 3 hours you worked, so based on that they will be paying your overtime. So they are motivated. It's not that their free time they're spending in completing these courses, and resulting in increasing the job satisfaction and improve the patient outcomes and optimized care process. And what are the recommended interventions that provide effective equipment and infrastructure, as I said. So whichever area they are working, they should have adequate supplies and equipment, so that they'll be it's easy for them to function. Provide adequate supplies, yes. Provide effective technology tools and data. So if there is effective tools like electronic documentation and the drug delivery, like we have we have a system where the medications are delivered, where you don't need to like counter check many times. If you scan the patient and scan the drug, okay, so automatically it tells you are giving this, it's a right drug and right dose and everything. So it is like easy for you to like deliver, take care of the patients. It's not necessary to verify every time. Also you have, in your software you have your action of the drug, in case if you have a doubt or something, like if the two drugs are reacting with each other and you have a doubt, so just you can refer immediately. And you have the pumps and infusion pumps and everything which is accurately calibrated. Just you scan the medication and fix into the IV, so automatically the dose will be calculated and it is delivered to the patient. So if that technology and tools which is incorporated with your everyday work, so it's easy for the nurses to work. And next one is provide safe and decent working condition. Yes, exactly. So create a decent working condition is critical for well-being and retention of nurses. Like if they feel if they're comfortable in their job, satisfaction is very important, and they should feel they're safe and secure and comfortable. There is no threat and no pressure, so they're happy to work. And so if it is safe and healthy and supportive work environment, it helps to reduce the stress and prevent the burnout and improve the job satisfaction. Yes, of course, that everybody knows. And by prioritizing decent working environment, protective policies and sufficient rest period. Exactly. The nurses should have an adequate rest period. Maybe it can be an hour in 8-hour shift, or 30 minutes in an 8-hour shift, or hour in a 12-hour shift. And based on that, according to the hospital policy and recommendations, they should have adequate rest period, which should uninterrupted rest period, not that they gave the rest period and everybody is disturbing them. So healthcare organizations can ensure nurses maintain their own health and well-being while equipping them to perform at their best. So that means every year they have to have a screening of their health, eyes and dental, so all those things. So also the vaccines which is recommended to that particular period, they have to make sure that they are vaccinated, like influenza and coronavirus, which is very common. So that whatever the maintaining the health, so they should get the benefit from the institutions where they work, like medical insurance and benefits for illness and sick leaves and all those things, so that they will be happy to continue their work there and improve the patient outcomes and overall health system sustainability. Next one is what we can do for that. That's recommended interventions create a decent working conditions and safe and healthy, supportive working, reduces stress and burnout. And by prioritizing decent working environment and protective policies. So this all will help them to retain in a working area. Next one is supportive education, professional development, and optimal scope of practice. So investing in the education and professional development is essential to build the skilled and competent nurses. As I said, so the nurses are expected to continuously update their skills and knowledge. So they're expected to complete particular CNE programs within each year. They have to complete that particular hours. One is by the nursing council, like Indian Tamil Nadu Nursing Council, or each state, Kerala nursing state, each state they have we have that one particular hours they have to complete in order to renew their license. So that is also expected by the nursing bodies as well as the institutions where they work, which expect them to complete a number of hours. Every year they have to complete 30 or 40 hours, which is relevant to that particular unit where they are working. So they have to submit in order to this helps them to update their knowledge, as well as also they provide a better care to prevent any complications or anything to the patients, and provide continuous learning opportunities to ensure the nurses equipped with knowledge, skills, and required to meet the new challenges and deliver the high quality care. Clear career development pathways not only improve the long-term job satisfaction but also support the workforce retention. Actually, also the hospitals will help the nurses to continue their educations. For example, in between, like if they wanted to complete some certification courses or they wanted to achieve any other courses, if they want to study, these hospitals sponsor them to study the courses, so they'll be coming back and working in that particular hospital and with better productivity. Investing in leadership development and strengthens the leadership pipeline, enable the nurses to shape the healthcare delivery at all levels. Also, we have to develop, maybe the experienced nurses in the units can be selected and they can be trained for the managerial roles, like nurse manager, assistant nursing superintendent, or nursing, and different leadership levels. They have to be trained, and so that we can improve the means people in a different level, not only working as a bedside nurse, also in the leadership goals. Additionally, empowering nurses to work to their full scope of practice enhances care delivery and strengthens the professional identity and increase motivation within the healthcare system. So for this, the recommended interventions is, number one is prioritize continuous education and professional development, support nurses working to their optimal scope of practice, involve nurses in decision making, and develop clear career pathways and leadership opportunities, and support nurses-led research and innovation. So also encourage the nurses, if they are skilled to conduct a research, to involve them in conducting research, nurse-led researches. So there are hospitals, I think even in India it might be, so the nurses only doing the researches in the areas where they are working. So to identify, it's usually, I think, by the nursing education department in the hospital, they conduct this, like how much is infection, number of infection occurred in that particular year, and then hospital acquired infections and deaths, and number of patients admitted, and what are the complications in the post-operatively, like common wound infection and bed sore prevention, all those things, some common topics which is usually conducted in the hospital, so that they can enhance their care. And the fifth one is build a supportive and high performance organizational culture. And fostering supportive and inclusive and high performance workplaces help to create positive practice environment where the nurses can thrive and deliver excellent patient care and contribute to overall success of health system. Actually, so we have to build a supportive climate for the nurses to work in that particular hospital, so that the organizational performance will be better. Like collaborative working culture strengthen relationship among nursing teams and improve patient care. So they have to have a team and they have to have a meeting in the particular unit, and the meeting between the different units of the hospital and under the guidance of chief nursing officer or a director or somebody, also between the meeting between the healthcare professionals, like different directors of different professionals. So they should have a collaboration meetings with them, so to understand exactly what is the policies and procedures, and how we can improve, how we can work collaboratively to improve the patient care. And cultures that prioritize people-centered care and continuous improvement, and team cohesion contribute to enhance and retain the nurses while ultimately improve the patient outcome. So they should have a team cohesion, and they have to understand like the problems experienced by the different nurses should be addressed, and they should not have any problems among them. So if they have a problems, and if they don't have a good communication and interpersonal relationship among the nurses in the unit and among the nurses in the hospital, so it's very difficult for them to work together for their better performance. And the recommended interventions, number one is embed people-centered care at the core of organization, commit to continuous quality improvement. So they have to check like they should have audit, nursing audit, or the audit in the hospital, so which helps to continuously improve the quality and build a just culture for the patient safety. So they should have good culture for the patient safety, so that there will be better cooperation, and they have a better understanding between the nurses and other healthcare team members to prevent any problems, like promote non-punitive environment. Like if there is somebody who made a mistake in a department, or if there is a problem experienced by some nurses, or faced by somebody, it is not that making them like so they made a problem and like everybody's talking about them and making them to feel ashamed. So it is not their aim. If it's common to make mistakes, if there is a chance to make mistake by each and everyone in some point of time, so it is not like a punitive environment. If there is any problem, error or anything happened, it should be there should be incident report made, and there should be adequate support given to the particular staff who make a problem, and there should be guidance and counseling, and the supervisor or leader of the unit can call them and talk and give additional training for them, so that the person who is having mistakes repeatedly, or there is something, so we can have a plan and separate action to make them comfortable and to work better, and promote inclusivity and diversity. So there should be inclusivity and diversity, so that everybody should be treated equally. There should not be any partiality, anything. There should be a proper mentor support for the new employees, and encourage open communication, and so there should be a knowledge sharing programs, like conducting small workshops or nursing discussion in the unit, so that if there is any new equipment is coming to the unit, if there is anything new procedure or policy is coming to the unit, so everybody should be trained well. So it is a responsibility of the in charge or a supervisor of the unit to train all the staffs in the unit, so that they will be comfortable in working, and recognize and celebrate nursing contributions. So in case like a best employee of the month, or best if somebody is appreciated, if the patient is appreciating a nurse, or they are giving some letters or sending, so they should be recognized and celebrate their contribution in their workplace. So it helps them to motivate better and contribute to their work. And ensure access to the healthcare and well-being supports. So nurses often faces barriers to access healthcare services tailored to their unique needs, and because of lack of support, so they are not able to provide their best care, and there is a emotional burden to deal with. So what we can do is like ensure access to the comprehensive physical and mental health. So they have to have see that wellness support. We have to see what is the stress. Everywhere we see that nurses, the burnout is very common among the nurses, physically and mentally. And so if they have seen a lot of deaths in a particular unit, a particular day, there is a it is mentally upset for them, and there is a something like a major incident happened in the unit, and it's like not only though they are taking care of the patient, their mental well-being also affected. So the adequate support should be given to them, so that they'll be feeling comfortable, and they have a less stress, and they'll be calm and composed to work. And then establish a special health and wellness and supportive services. So so as I said, there should be have health insurance, or health and eye checkup, and dental checkup, or psychological consultation. Everything should be given. I think all the hospitals are giving, wherever you work, the hospital is giving you the free treatment for a particular amount. And even not only in that hospital, so they should get the health insurance from the hospital, so that they can have their health is monitored well, and they are comfortable and adequate. Also they should have an adequate vacation period to take a break from the work, and it should be paid vacations so that they'll be, well supported during their rest periods also. And supportive services should be available whenever they need, and support access to their healthy lifestyle choices. So also, like the hospital, they have like a cafeteria, they have the yoga classes or mindfulness training, and then there will be the places where the hospitals here, maybe in India also, we have the gym facilities and everything. If they have some time rest period, if they want to work in the gym, they can. So all this healthy lifestyle choices they're supposed to have. Also the benefits they can, some hospitals they provide their meals maybe 3 times a day or 2 times a day. They give a meal, and the drinks and anything like whatever is given according to the hospital's policies and procedures. They can support the healthy lifestyle in the among the staffs, so that they'll be feeling comfortable to work with. And value nurses with fair and competitive compensation. Yeah, so appropriate compensation and recognition directly impact the nurses' satisfaction and retention. So if the compensation is given, it is effectively done. So the salary, the leave benefits, the healthcare insurances, so whatever the benefits which is available is appropriate for them, so they'll be happy to work there. And by investing in nurses with fair compensation structures and opportunities for career progression, and health system can create environments where the nurses feel valued and motivated and empowered to remain in the profession and deliver the optimal care. So what is the recommended action? Number 1 is provide fair and competitive compensation and ensure the pay, transparency and fairness. Yeah. So the government sector, okay, they have a standard payment and facilities, whereas in the private hospitals, there are the bigger hospitals, the tertiary care hospitals, they have a standard payment systems and facilities and leave benefits and everything which is available. But whereas for the some of the hospitals where they don't have officially having adequate compensations and things, so which is affecting them to leave the job and go, and ensure the pay transparency and fairness. They should have, there should not be any partiality among them. If the nurse is trained well and according to their education and according to their training and according to their contribution, the salary should be. It is not that she's my relative or he's my relative and they are so that I'm increasing their pay and promotion. So is everything supposed to be like done fairly. There should not be any partiality or anything when coming to the benefits to the staffs. And caring for those who care for the nurses. So ICN's caring for nurses paradigm shift towards comprehensive and integrated approach. And so this 7 critical domains addresses complex web factors that influence a nurse's health and retention. Okay, so all these interventions require systematic changes and overcome ingrained cultural and historical barriers. While these large-scale changes will require time and commitment, and payoff are great. When we care for nurses, we strengthen the healthcare's most valuable asset, and which has power to transform lives and communities and economies. So in conclusion, the report emphasizes that urgent need for strong nursing workforce to tackle rising healthcare challenges like aging and population and chronic diseases. So without proper support for nurses, we cannot effectively address these issues. So nurses face significant challenges that impact their well-being and the stability of health system, which leads to high turnover and cost. So what we can do, like the ICN Caring for Nurses agenda provides a roadmap. This is giving a roadmap and clear-cut environment where the nurses can thrive. So the world recognizes nurses as a most trusted profession and celebrate them as a healthcare heroes. However, if we truly value their vital role, healthcare and systems and community, we must take action to support them. So as the largest health professions and the backbone of every health system, the nurses address complex health challenges and provide essential care. So the future of global health relies on urgent effort to improve the working conditions and well-being of the nurses.
If there are any questions, feel free to put it in the chat box below so that ma'am can answer. If there are no questions, we'll move on to Madhavi ma'am's presentation. Thank you, ma'am, Vasanta ma'am, for your wise words. We've definitely taken up some very important points to note. We'll move on.
Thank you. Thank you so much. Thank you so much.
Thank you, ma'am.
Have a good day.
I'll go on to introduce the next speaker, Mrs. Madhavi. So Mrs. Madhavi is a nursing profession with 25 years of experience. She has headed many nursing operations in renowned organizations all over India. She has led teams to secure the JCI and NABH 5th edition Nursing Excellence Accreditation, and at Wadia Hospital and Fortis Hospitals. She holds a fellowship in evidence-based nursing practices from IAEBP, and she has received even the Florence Nightingale Award in 2023. She has recently conducted a 7-day workshop and trained 40 farmer women on a happiness program. So we gladly welcome you, Madhavi ma'am, and we hope we would get good inspiration from you. Over to you, ma'am.
Good evening to you all, and thank you for being so patient. And it was wonderful to listen to all the speakers. So my dear nurses, all the nurses that are here, what I heard on the first session and on the second speaker talking all about was investing. You know, they all are talking about investing in nurses. So in the first session that we heard was what happens if they don't invest. And in the second, we heard what all and how are the things that are recommended that can keep the nurses, that can be invested into nurses, and hence, so they can be retained and all these things. Now, let me tell you all, why do you think this health organization should invest in you? Why? What do they get? So here is our topic today, return on investment from caring for nurses. So when we say return for investment in caring for nurses, just a moment. Yeah. So the main is, we all heard in the past two sessions, what is the importance of nurses in the healthcare delivery, the increasing challenges, the burnout, shortages, job dissatisfaction, the purpose to show how caring for nurses yields tangible. So all we are going to do in this session now is understand how caring for nurses yields tangible and intangible return of interest. Now, you all must be thinking, what is ROI? ROI. You must be heard from your finance team, your accounts team is always talking of ROI. And if some of you are already leaders in a manager role, you must be sitting for certain management budget meetings where each and every person talks ROI. So my dear nurses, what is ROI? So the ROI is equal to, in a very mathematical languages, the net profit divided by the total investment into the 100. Now, the total investment is us in the healthcare. We, the nurses, imagine the net profit that they ball and they draw in. So the investment that is done in us, the investment that is done into our mental well-being, the investment that is done into giving us a good environment, the investment that is done into keeping us engaged is yielded for them into hundreds of it. So let's go ahead with this. So caring for nurses, I'll not go very detailed into it. It's about the fair compensation, safe staffing values, mental health opportunities, recognition, and respect. Now, cost for not caring. We heard about that also. If you're not caring environment, you have a high turnover, you'll have burnout, absenteeism, poor patient outcomes, increased legal and reputational risk. Let me tell you, your friends, legal repercussions in an organization can cost an organization per patient, even it can go, I'll talk in INR, it goes to up to 1 crore, where the organizations are still going into the courts and doing all this. So it goes to a very big thing. And the financial burden on recruitment and training. So we already heard it is almost your annual salary, of certain annual salary if you go into the overseas for recruiting a nurse, training, and then losing her. That is cost for not caring for the nurse. Now, what are the direct ROI metrics? So the reduced turnover rates, that replacing a nurse can cost, I am talking here in dollars, 40K to 16K. Imagine getting her on board, inducting her, training her, matching her skills to the given department, and then losing her. So the time is money. The time spent on training her is money again. The decreased absenteeism. The healthier staff is equal to fewer missed days. You have a healthy staff coming there to take care of your patient. Improve retention. Long-term nurses improve the care quality of the patients. Now, what is the direct ROI metrics? So what is direct? What happens if the nurse investment in the nurse is caring for nurses is right? You have improved patient outcomes, higher patient satisfaction scores, fewer medical errors. So no lesser lesser chances of a patient or a relative suing the organization. Stronger employer brand. If you become a brand, you love to work in an organization which is already a brand. You look forward to, fresher looks forward to joining best of the industry in the country or overseas. Now, these are certain numbers that you see. If you return on investment from caring, what is it? So before, actually, when an organization, before investment, the turnover cost was 50,000, absenteeism days were around 15, patient satisfaction was around 70%. After they invested into all the XYZ that we spoke, all the two speakers spoke about, good environment, good pay, good growth, everything. What comes? Its turnover cost reduced to 20,000, absenteeism rate reduced to 5, and patient satisfaction went high up to 90%. So there are certain case studies in different organizations and data. So I'll talk to you about a certain, there are these numbers. There are lower nurse turnover and vacancy rates, turnover rate in magnet hospitals that shows to 11.5%. So natural average shows to 16%. So the ROI impact reduces the recruitment and training cost to 1.2 million for a mid-sized hospital. Look at this number. So in our country, in certain developing countries, we know what our nurses are getting paid. But very proud to say currently in India, so when currently in India, way back 2 decades back, there is where people are now sitting up and talking about investing in right skills, in nurses, grooming them, so they know what the EBITDA, the good profits that they earn. If they invest in a nurse, if the nurse remains with them for at least 2 years, it's a huge profit for them. It's not only by retaining the nurse, the business that they earn from the healthcare, the profits are exponential, my dear friends. The other things are the improved patient outcomes, up to 14% lower mortality, lower incidence of pressure ulcers, infections, and falls. A satisfied staff, satisfied team is more alert about the alarming signs, the EWS, the MUs, the PUs. Yeah. So the incidence reduce, better patient satisfaction scores, higher nurse satisfaction engagements get you greater. Nurses in magnet hospitals have reported greater autonomy. They're taking accountability. They have an ownership, more opportunities for leadership and education, and higher satisfaction, as well as the commitment. This improves retention and reduces absenteeism. When you own something, when you're accountable for something, but obviously you will stand by it and you're committed to it. The financial benefits about it, the fourth one, the hospital with the magnet designation outperform the peers on the financial performance. So the cost savings can come from fewer complications, lower malpractice risk, better staff productivity. The estimated ROI shows around 700 plus. On a nurse-related investment, isn't it great? And the reputation and the market advantage attracts top nurse talent, improves hospital rankings. So as an example, in US News and World Report, you must be listening to wonderful organizations, how they grow and how they have retained and practice all these things, and increases referrals and patient volumes. So when we see a lot of creamy layer would leave their own nation and go to a better country to get medical facilities, we all are aware of that. So not only these, this is some examples that are overseas, and we have wonderful example currently in the best of the chain of hospitals in India. So currently in one of my past organizations, what they started was one of the pay where they hire nurse satisfaction and engagement. They have selected, the eligible nurses to be groomed in the best of the educational institutes, that is STITs, to train them for an operational management. And these 20 nurses will come back to this hospital chain and become a CEO or an operations head. Isn't that great? So this is how we also are moving slowly and steadily. And this is great. It's really great. Even there is some remuneration and awards in case of the nurses. The organizations are naming the national award after the hospital name or the organization, and also giving a cash prize or as big as 50,000. 3 cash prizes of 50,000, and then the rest of the 2. So these are they are naming after their organization. This is also a wonderful thing to have them on board. Now, the cost benefit analysis, the investment versus the benefit. So mental health programs investment shows a lower burnout and the turnover. Leadership trainings gives a higher job satisfaction, better engagement. Flexible scheduling gives a job satisfaction again, and recognition programs gives an improved morale. Long-term gains for the organizational shows us as organizational resilience, culture of safety and excellence, attraction of top nursing talents to the organization, and a sustainable healthcare delivery. Now, recommendations. So prioritize your nurse engagement and wellness. Monitor key metrics, that is turnover, satisfaction, and patient outcomes. So when you have attrition, we really practice this. So when we have an attrition or a nurse goes away, so we have divided it into different things. We have an entire matrix which says, we find out, we do an RCA, why that nurse is gone, and we zero down onto the what was the reason that we lost that nurse. So it's a wonderful thing that many of the organizations practice. Create a feedback culture, a constructive feedback culture. So there are certain initiatives which go on for the onboarding nurses from 0 to 6 months or less than 1 year, where they practice initiative like coffee with the CNO, where the nurse has openly, she can talk about the things, about the environment to her immediate, the highest superior. And there the solutions are found out, and there is a transparency and inclusivity into her onboarding program. And then invest in the continuous development. So caring for nurses is caring for healthcare. This is all the organizations all across the globe understand it and practice it at different levels. ROI goes beyond numbers, loyalty, and leadership. It's about lives. It is about the lives as we as healthcare workers, we as nurses, give it to the entire community. Every dollar invested yields lasting value. So every time we see a patient or a nurse or an ICU nurse who's worked so hard, who are doing double shifts or working hard to support her own family, we try to feel, I wish I could take some of your stress, some of your worries, pain, heartbreak. I wish you take a larger package of extra energy, strength, love, and compassion that is needed, And what we end up saying is only thank you. So my friends, thank you is not enough. It's really not enough. We need to invest in these heroes. We need to invest into them rightly. So thank you so much. And for this opportunity, I would like to actually have these organizations sit for the search sessions. Good that our nurses are getting aware that they are a golden investment for any healthcare, but even the investors need to know why it is important for them. So thank you, everyone. Thank you for your patient listening. Thank you for my co-speakers also.
Thank you to all the speakers who have graced their presence for this webinar and sharing their important points and their notes and their thoughts on this year's nursing theme. So I would like to give a special thanks to all the creators of Nurseslabs. So their efforts have made this webinar a success. Thank you to all the speakers.